Hi, so I am Dr. Varun Malhotra. I am the consultant in cataract, cornea and refractive services at Center for Sight Eye Hospital, Banjara Hills, Hyderabad at road number 2. So today I'll be talking to you guys about the general concepts and the myths which are prevailing regarding the refractive surgery. About 30 to 35% of the patients which I generally see fall in the subset of the opinion for refractive surgeries. There are 6 different procedures which can be done to completely remove you of your sight. These are generally PRK, the aspheric or the blade LASIK, the femtosecond laser assisted femto LASIK, the new advancement which is the Relax Smile. We also have an implantable collamer lenses also known as ICLs and the clear lens exchange. There are 3 different types of refractive errors found in the patients. This can be myopia, that is long-sightedness. It can be hyperopia, or it can be presbyopia, which is short-sightedness. Right now, the refractive surgery can alleviate powers both of myopia as well as hyperopia. The presbyopia is not treatable right now by a refractive surgery. We generally tell the patients to undergo a corneal topography and a corneal pachymetry, which tells us about the thickness of the cornea and the general contour or the shape of the cornea. Once we look into these 2 parameters, we can customize the treatment for the patient after correlating it with his powers. Aspheric PRK or photorefractive keratectomy is the treatment of choice in the cases where the thickness of the cornea is less than 500 microns, or in cases where the corneal curvature or the keratometric values are much steeper and wherein we do not want to make a flap. The aspheric or the blade LASIK is a procedure wherein we use the microkeratome to cut the cornea at a predetermined depth of 100 or 130 microns to create a flap which is 270 degree in nature with a hinge, which can be either superior or nasal depending upon the surgeon's comfort. Once we lift the flap up, we use an excimer laser to ablate the cornea so as to remove the powers and then put the flap back. The second procedure is the femtosecond assisted refractive surgery, or the femto LASIK as we call it. In this, we do not use the microkeratome but use another laser called as the femtosecond laser to create the flap. The major advantage of this is that the depth is almost always accurate at which we make the flap. Also, the edges are extremely smooth and well rounded, and thereby the healing time required is much lesser. The second step, that is the excimer laser ablation, remains the same as in like the blade LASIK. And the third procedure is known as the Relax Smile, wherein the ablation with the help of an excimer laser is completely obviated. We use only the femtosecond laser to create a lenticule intrastromally which corresponds to the refractive error. Once the lenticule is created, we go inside and do a dissection both in the anterior corneal plane and the posterior corneal plane to free the lenticule and then pull it out via the 2.8 millimeter small incision which we have created. This is also known as a flapless and a bladeless LASIK, and thereby there is no damage to your corneal nerves, there is no flap created, and hence you do not have complications related to flap or complications of dry eye and glare, which were more commonly associated with the classical LASIK. ICL or implantable collamer lenses are generally indicated in patients wherein the corneal thickness is much less, the powers are very high, that is patients associated with very high myopia, wherein excimer laser ablation or the femtosecond lenticule which we create in SMILE is not indicated. The ICL is generally put in the area between the iris and the lens, also known as the sulcus. However, the anterior chamber depth in these cases should be above 2.8 millimeters. The ICL nowadays have a hole in the center which is known as the Centaflow technology, and as a result we now do not experience an increased intraocular pressures which we used to find which were earlier associated with these kind of procedures. The final procedure is called as a clear lens exchange, which is generally indicated only when neither of the earlier 5 procedures can be used to correct your powers. Here we remove the clear lens and thereby implant the intraocular lens, which are generally of very small powers, and as a result we generally make the patient emmetropic. There are certain myths which are associated with the refractive surgeries. So I would want to clear all these myths for you. Number one, there is no admission required in the hospital in these cases. Any of these surgeries, which would classically take about 15 to 20 minutes, as soon as the surgery is completed, you are immediately discharged from the hospital. The eye is generally slightly reddish with mild amount of watering on the day of the surgery, which improves within 24 hours. In cases of PRK, it may take up to 3 to 4 days for this watering and redness to go completely. As soon as you reach home, you can start seeing TV, you can work on the laptop, you can also use your mobile phone. There is nothing to stop you from using these appliances. However, you do experience some amount of sensitivity to light, and thereby I generally tell all my patients to wear some kind of goggles or cooling glasses, as we say. These can be of any nice brand, something like a Ray-Ban goggles or a Polaroid goggles. You need not wear the punk glasses of the patients. There is no dietary restrictions. You can eat your veg, non-veg, you can have your chicken biryanis on the same day itself. There is nothing to stop you from having anything. You do have to observe certain precautions. You must avoid going to the gymnasium, doing very heavy physical exercises. Try to avoid cooking on the first 2 to 3 days, because we don't want you to have exposure to fumes, which can be a source of infection. Try to avoid swimming however, you can definitely go for a walk in the garden. You can go and meet your friends. Try to avoid exposure to any public places. We will be giving you drops after the surgery, which tend to continue for approximately a month, a little longer in cases of PRK. So all in all, so the whole idea or the objective of making this video is to put across that we do have in place nice, very effective and efficient surgical procedures which can completely remove you of your glasses. The precautions to be observed are extremely common and very less. You do not have to lock yourself up in the house after you do a refractive surgery, which is a common myth prevailing around. And the efficacy and nowadays the results of the refractive surgeries is very good. They are 99.9% safe. So I would like you to watch this video. I think this video will remove most of the misconceptions associated with the LASIK surgery. And for any further details, please do come and visit us. Thank you.